Hi everyone, this is Dr. Giobbi, and we're looking now at rational emotive behavior therapy. This is an approach that early in my studies of psychology in undergraduate work, this approach really caught my attention. And the person who's behind it has now passed away. But when I started studying psychology, he was still alive, Albert Ellis, and you'll see him in the video demonstration with Gloria from the Gloria tapes that I include on the Canvas shell for this week. Albert Ellis was a unique character. He started his training as a Freudian, as a psychodynamic psychologist. He got his Ph.D. or EDD, Education Doctorate, at Teachers College at Columbia University. Incidentally, in recent times, many of my former students from Rutgers go on to Columbia's Master's in Education program in counseling. So Ellis found that the psychoanalytic work was useful, it was insightful, but it wasn't giving him the changes that he really was seeking to find in himself and in others. And he went on to start trying experiments with himself. He tells about this in one of his texts. He talks about, and I recommend any of his texts, they're all great. He talks about how he was terrified to approach women to ask them out on a date. So he, using what we would call behavioral flooding technique, he told himself that for the next week, for a 1 week period, he was living in New York City at the time. For a 1 week period, he would approach every woman that he could in Central Park and chat them up and ask them for a date. And he found through this, some of the women that he approached, he was interested in. Some he approached, he was not interested in. It was just a matter of seeing what he could learn about approaching women and about himself. And what he found was, after the end of a week of doing this, some women were interested in going out on a date with him. Some women were not interested in going out on a date with him. And he not only overcame his fear of approaching women, he also came to not be afraid of rejection. And this led him to really thinking about the fact that how we think about things really influences how we experience them. So looking at approaching a woman in his experiment, looking at how approaching a woman to ask her for a date was a very frightening thing that he couldn't bring himself to do, by realizing that it was his expectations that were the frightening thing. The actually talking to the woman and asking for a date was not the problem. It was the expectation and what that expectation meant. If they say no, I'm a bad person, I'm an ugly person, I'm undesirable, I'm a failure, I have nothing to offer. And he came to think about the self-talk that we do. And he found that changing the self-talk, changing the belief, changed how we felt, which then changed how we behaved. And this is how he developed, this is just one of the examples he talks about, how he developed rational emotive behavioral therapy. Rational is logical thinking, emotive is feeling, behaving is acting therapy. And we usually include this as one of the first cognitive therapies. I chose this REBT as the representative of cognitive psychology. And you can read when you have time chapter 13 on cognitive behavioral therapy. But I think REBT is much more nuanced and I think much more interesting than cognitive behavior, than CBT, cognitive behavioral therapy. But they're both cognitive therapies. The idea here is that we don't see things as they are, we see things as we are. We don't, it's not things that disturb us, it's how we think of things. That's Epictetus. And in fact, much of these ideas of Albert Ellis, much of his thoughts come from what we call Stoic philosophy. This is a Greco-Roman philosophy, meaning that it was a philosophy that became popular during the transition from the Greek dominating empire to the Romanized empire, and many of the Romans became Stoics. Epictetus was a Stoic philosopher. Today, Stoicism has become quite popular, and it's about rational living. It's about using logic to challenge our feelings and our beliefs. So we are going to take a look at this technique. Again, it's a very powerful technique, and we're also going to look at how you use this with children, because of course approaching children with this therapeutic technique is quite different than using it in adults. But you'll also be able to understand it on your own. I want to start out by looking at some of the basic theoretical ideas that Ellis outlined in what he called a rational emotive behavioral education program. So teaching children, teaching adolescents, and teaching adults how to become more aware of the beliefs, the beliefs that they maybe don't speak out loud, but they came to learn from their parents and from growing up, and just incorporate into themselves, and how those beliefs became automatic filters for how we interpret things that happen in life. And of course, we all know that human beings do not function in a stimulus response way, that we have an O between the stimulus and the response, the organism or the outlook or the worldview. So our parents and the beliefs of our parents and how they view the world greatly influence our childhood development of how we interpret the world. And part of REBT is relearning how to function in the world in a more liberated way, a way that could be liberated from the patterns that we learned from our parents. Your textbook, which I'm going to just read a passage from on page 394, Ellis claims that all children act neurotically simply because they are children. He states that childish behavior cannot be differentiated from neurosis until the age of 5. At this point, many children have integrated into their belief system the irrational belief that one should be thoroughly competent, adequate, achieving in all possible respects to be considered worthwhile. Strategies for undermining this philosophy in children can be summarized as follows. So he says that in childhood, children up through the age of 5 are all neurotic. They all have irrational beliefs. And then unless they learn otherwise, unless parents shape their thinking and teach them skills, and as you see, I'm sure you look around you and you can see in the world families that seem to have better strategies in living, very better life strategies than others. Some families seem to have errors that they keep making over and over again. And then there are other families that seem to know, the parents know how to avoid the errors, the children learn how to avoid the errors, and it's a learning process. And what Albert Ellis is saying is that REBT is a way of educating a child and later an adolescent or even an adult into more pragmatic, maybe is the word, or more successful ways of living, more successful ways of looking at the world, more ways of beliefs about the world that will result in more successful outcomes. So part of the education program, he says, teach children the joy of engaging in games that are worthwhile because they are fun. De-emphasize the importance of winning at all costs by teaching children that you do not have to win to have fun and be a worthwhile person. Now that's identical to what we studied with Alfred Adler. And it's also illustrating Ellis's caution with a mere behavioral approach, where behaviorism is part of this, but it's not. It's only an aspect. The flooding of his desensitization project with approaching women for a date was only part of the project. There was also a feeling and a thinking aspect that needed to be addressed, not merely just a behavioral aspect of this. Number 2, teach children that significant achievements rarely come easily and that nothing is wrong with working long and hard to achieve their goals. Teach children that they are not bad people when they do not meet their goals. Children must like themselves during periods of failure, even when they may not be trying their best to achieve their goals. Children also need to learn the difference between wants and needs. Wanting something we cannot get is not the same as not getting something we absolutely need. Number 4, teach children that although striving for perfectionism in performance is good, perfection is not required to be a worthwhile person. Making mistakes is not only allowed, but also is a good way to learn why certain things happen and how to prevent them from happening again. Number 5, teach children that popularity and achievement is not necessarily related, that to be liked by all people at all times is difficult, and that being a worthwhile person does not require 100% popularity. And number 6, in summary, teach children not to take themselves and situations too seriously by turning minor setbacks into catastrophes. Balance corrective feedback with positive reinforcement in evaluating children's performances. These are 6 very important concepts that you can educate children in that really illustrates the ideas of REBT, Rational Emotive Behavioral Therapy. So if we approach this idea, we can see, as we have described, Ellis had some discoveries in his theory. Clients treated once a week progressed as well as those he treated daily. So in classic psychodynamic therapy, you would have daily therapy sessions, and he found that once a week was enough with his patients. That's once a week with homework assignments. So exercises, such as the experiment he did by in the park when he was younger and asking women out to confront his fear. It also has to do in these homework assignments with contemplating what one learns from doing the homework. And we find that this is similar with the Gestalt approach, the homework approach. He found that he got faster results when he took a more active role. So when it wasn't only thinking about his issues or analyzing the thought process and the feelings, but also changing his behavior and seeing what that had to teach him. He discovered that interjecting advice and direct interpretation yielded faster results than a passive psychoanalytic procedure. So Ellis was very popular for being more directive, just like maybe Fritz Perls, more confrontational. Although Ellis did it with humor. Ellis used humor quite a bit, having funny songs that he would sing to the patient, having funny sayings. You'll see this in some of the clips. humor was, if you get his book on REBT for therapists, you'll learn some of these funny things that he would do, and he found that humor was a great way to help people to manifest change in their life. He developed a rationalist philosophy. Rationalist means a thinking philosophy. Change behavior through confrontation, change irrational beliefs to more rational ones. We really find in Epictetus the gist of the basis of REBT. What disturbs men's minds is not events, but their judgment of events. So in other words, it's not things that disturb us, it's how we think about those things. People are neither good nor bad if they respond to others with a rational belief system. So what this means is when you start looking at behavior not as good and versus bad, not as an ethical or a moral distinction, but as useful or unuseful, or adaptive or not adaptive. This is very similar to Adler as well. You can see that many of Ellis's ideas he took from ego psychology, as well as the work of Adler and other more humanistic and psychodynamic thinkers, but he did it without the stuff focusing on the past, without dream analysis and things of this. If they react to irrational beliefs, they view themselves and others as evil, awful, and horrible whenever they fall short of the expectation. They think crookedly about their desires and escalate them in a self-defeating manner of musts, shoulds, oughts, and demands. This is a great, number 4, if you're interested in exploring some of these ideas in depth, get a book by Arthur Freeman called Coulda, Shoulda, Woulda. You'll find this on Amazon. And also his book, 10 Dumbest Mistakes That Smart People Make and How to Avoid Them. A great book for REBT. I'll include Freeman in the links for you to look into. He's a Philadelphia-based psychologist. In assimilating these irrational beliefs, people become emotionally disturbed and feel negative feelings. So the cycle of irrationality is you get an irrational thought, you dislike yourself, you engage because of the thought, you engage in behaviors that are reacting to that negative thought. You dislike others, especially ones that seem to have the success that you're failing in, and then others kind of get the bad vibe from you, and it's just the circle of irrational thought. And the idea here is that most of us live lives thinking that we are out of control of these situations, that bad things keep happening to us, when in fact it's the way we think about things that invites the bad vibe into our lives. So we have to look at these ideas of irrationality. And Ellis outlined 3 areas of irrational beliefs. So these are ideas that the irrational belief ideas are those that we've learned from our parents, and that we then adopt and never question. We just assume that this is the way the world is, and then, through reading, through talking with others, through learning, through exploration in these experiments, we come to challenge the irrational beliefs that we learned in early childhood, or that we never grew out of, and we learn to think more rationally, become more aware of how our beliefs affect how we feel and how we behave. So here are 3 areas of irrational belief that Albert Ellis discusses. I must be perfect. It's awful when I'm not perfect, therefore I am worthless. Worshipping at the altar of perfectionism is a big problem for many of us. Regardless if it's, in my world, studying music and making the perfect performance. I remember a teacher in conservatory being telling us we're only as good as our last performance, basing a sense of self-worth. Now this, incidentally, when you're at this high end of music making, there's a certain neurosis that's necessary, because that's why people go to hear your performance, because it's so amazingly perfect. Although There are some artists, like Vladimir Horowitz, concert pianist, who would make numerous errors in his performance, but his performance was so authentic, so sincere, so moving. His use of dynamics, soft and sensitivity, soft and loud, and rubato changes of tempo, and just such intelligent phrasing of the melodic line and the harmonic material was so profound and so sincere that people overlooked the little flubs that would happen in his playing. And it's very interesting to consider that. But we also have other ideas of perfectionism that are outside of the world of performing arts, such as needing to look perfect, needing to look like the people in the TikTok video with these filtered faces and these perfectly made up faces or bodies and things like this. So there's a lot of these ideas of perfectionism and self-image. This idea that I must be perfect, and if I'm not perfect, I'm worthless. That's an example of an irrational belief. Another irrational belief: others must be perfect. If people don't treat me fairly and honestly, they should be utterly damned. This expectation on others is another very common irrational belief. It reminds me a little bit of the idea people say, but it's not fair. To me, this concept of being fair is a very childish way of thinking. An adult realizes the world is not fair, and there's really nothing owed to anyone in as far as being fair. Fair is nice. There might be some areas where fairness is a legal issue, but other than that, it's really something that you just have to accept, that fairness is not a given in life. It's something that we all come to have to manage. So changing our expectations, our belief about what we're owed in the world, owed in life, as if by magic, is a very useful way of becoming rational. And another area of irrational beliefs: the world must be a perfect place to live. Pleasure is better than pain, therefore life is horrible when I am in pain. In the Buddhist psychology, the Four Noble Truths, number one is life is suffering. This is another irrational belief that somehow the world that you deserve to be happy, or that you must be happy. This is the idea that you should live a life without pain, and if there's any discomfort or any pain or anything negative, then your life is a failure. This is an irrational belief. Life has pain. Pain is necessary. Disappointment is an essential aspect of living. So these are three areas of irrational beliefs. I would like to take a moment to look at what we call the cognitive distortions. So there are a number of these cognitive distortions, these beliefs, faulty beliefs that interfere with our ways of thinking. So you can find these on page 387. I've also included a PDF that you can look at. Look at 387 counseling methods. So what you do is you look for an ABC. So an A is an activating event with a client. So the child comes in, the adult comes in, the adolescent comes in, and there's something that there's an event that's caused them grief, upset, something bad, feelings of concern. For example, a child acted nasty to me. Classmate acted nasty to me, a young child says. 9 years old, comes in to see you, and they're describing how some child is nasty to you, makes fun of them at lunchtime, etc. That's the activating event. The belief that is you look at the belief, the consequence is I feel sad because this classmate said nasty things to me. Now, that consequence is the result not of the child being people saying something nasty to the child. It's the belief the child holds. So, in other words, someone could say something nasty, the same thing to 2 different people, 3 different people, and the 3 different people may have different reactions. One could say, "Wow, I wonder why that person's so nasty. That person must be miserable. They must have a sad life that they need to be nasty to other people." The second person might say, "Oh, they're nasty to me, therefore I'm not a likable person, therefore I'm worthless," and feel depressed. And a third person could think to themselves, "That person's nasty. I wonder if I did something that I'm not aware of that made them angry at me, or if there's something that I should be aware of in myself." These are 3 different reactions to the same event, the same activating event, the belief, and then the consequence is what you experience. And this illustration shows you that the consequence doesn't come from the action, from the situation. It comes from your belief about the action. So this is the idea of an ABC method. In the D, there's a D, and that's when you dispute the belief when you're in therapy. And the E is the final new way of approaching the world, a rational way. So let's take a look on page 387 at some of these cognitive distortions, or what are commonly called stinking thinking. And these are really well explained in Arthur Freeman's book, The 10 Dumbest Mistakes Smart People Make and How to Avoid Them, and also Albert Ellis's own A Guidebook to Rational Living. Both are linked in Canvas, and you can find them on Amazon. So, number 1, look for overgeneralizations. Many people overgeneralize. I made an F on the first math test, therefore I always do poorly on math tests. This is one of those ways of thinking that's often found in our parents. One of our parents, we've been raised with this kind of demonstration of this logic, this irrational logic. Here's one that I find quite frequently. A student takes a class and they find that the class was boring and uninteresting, therefore they don't like the topic. And I have always said there's certain professors know how to make any topic interesting. And there are other professors, in my experience, that know how to make even the most exciting topics boring. So I would challenge the individual to considering if maybe it wasn't the topic that they were not interested in, but maybe the presentation that left them cold. So this is the overgeneralization. I didn't do well at piano lessons when I was a child, therefore I have no musical talent, no musical ability, I'm not musical. Again, it may have been the approach, it may have been the time of life, it may have been many things. Overgeneralization, we have to be very careful not to make overgeneralized statements about our experience and catch ourselves when we do make those statements. Number 2, look for distortions, sometimes referred to all or nothing thinking, or black and white categorization of things, all as all good and all bad. I did not make all A's on my report card, therefore I will never be a good student. My goodness, here's one for individuals who are on a diet. The individual goes on a diet, they've been successfully on the diet for a week, or 2 weeks, and then suddenly a craving comes in and they eat an Entenmann's chocolate cake. The whole thing. I've ruined it. My diet's been destroyed. I failed again. And they give up and start eating. They abandon their diet. Now, compare to that irrational thought to this rational one. I've done pretty well on my diet up until this point. I made it through 7 days. I had a chocolate cake. Time to get back to my diet and forgive myself for this 1-day error. It's more rational. It's not all or nothing thinking. Just because you make a flub doesn't mean the whole thing is ruined. This is another one that I've encountered with people in music lessons. It's actually something I have encountered in something in myself. Making a small error doesn't ruin the whole piece. If you're playing a piece, you have something that's not quite perfect. Say one passage was not played quite as well as you would have liked to, but it doesn't ruin the whole piece. Most people don't pick it up. Most people forget it. This is all or nothing thinking. It's black or white. So be aware of that stuff. Look for deletions, the tendency to focus on negative events and to overlook positive events. For some reason, negative criticism sticks to us like Velcro. And I like to say that positive evaluation slides off of us like Teflon. Whatever it is, if you're getting reviewed for something, and whatever the negative things are that people will mention, that will stick with you. It's just a human tendency. And the positive things we kind of overlook and dismiss. It's a very irrational way to live, but it somehow seems to be part of the human condition. And not only is it part of the human condition, it's also often reinforced, that belief, that irrational belief is reinforced with us through our parents and through society. So I struck out 2 times and got 1 hit. Therefore, I'll probably strike out the next time I bat. So this is like negative editing. It's overlooking the positive and focusing on the negative. That's irrational. Equally irrational would be only looking at the positive. One of the criticisms of this new positive psychology movement, where you think you have to only think about the good things. Nonsense. That would be deleting in the other direction. You have to look at both. Have a balanced look at life. That's the rational. Understanding sometimes you fail, sometimes you succeed. That's what being human is all about. Number 4, catastrophizing. This is a big one. Catastrophizing. Mistakes are exaggerated and achievements are minimized. I was just lucky to get that A on my test. It's very interesting. Catastrophizing is a real big one. It's making mountains out of molehills. It's taking one disappointment and allowing that one disappointment to overshadow everything else that we do. You can start to see the theme that's coming about here. Number 5, look for the absolutes such as should, must, always, ought, and never. I should not make mistakes. That's what is explored in the Coulda, Woulda, Shoulda book by Arthur Freeman. Also, Ellis explores it in his Guide to Rational Living. Look for these shoulds. Examine these shoulds. I should not. I must not. I always. I ought to. I never. These are really extreme, kind of belligerent ways of attacking ourselves. And if you become aware of your thought process, how do you become aware of your thought process? Well, you think about, you sense an emotional reaction. You start to feel down on yourself. You start to feel bad about yourself. You start to think a icky feeling, you might say. You start to feel bad, and you say, well, the kind of learned idea here is that, well, what's making me feel bad? And we start to think about other people or other things. And once you feel bad, you take feeling bad as the cue to look into it. And then you look at the event that caused it, that you think caused it, and then you say, well, I know it's not the event. It's the way I'm thinking about the event. And you start analyzing your thoughts about the event and see where they fit into one of these cognitive distortions, into one of these stinking thinkings. And then you start to challenge that. You challenge the belief and try to come up with a belief that would be more productive in your life, more accurate in your life. not one that leads you in the other opposite end of neurosis, into another fantasy land, but into a more realistic way of viewing things. Look for number 6. Look for, this is on 388. Look for statements condemning something or someone clients think they cannot stand. He should be punished and should not be allowed to get away with that. So condemnation is another irrational thing. This is very easy to slip into. I remember when I first started studying Chogyam Trungpa, who is a great Buddhist psychologist, founder of Naropa University out in Colorado, first Buddhist psychology university, another school that a number of Rutgers former students have gone to get their graduate degrees there. And Trungpa said the first thing we need to do in our lives is stop judging. Stop judging others and stop judging ourselves. Now, judging doesn't mean stop judging doesn't mean stop observing. You can still observe. You observe and you say, oh, well, this behavior is a better choice, or more, this behavior is a more productive or more adaptive behavior than the other behavior. That's observing. Judging is that person's bad because, I'm bad because, I'm good because, they're good because. Judging is seems to be at the root of many of our difficulties in life. So look for statements condemning something where clients think they cannot stand. He should be punished and should not be allowed to get away with that. Replace that with that person is making decisions that aren't the best decisions for themselves or for others around them. And then that leads to ways of not feeling anger and resentment and the desire to punish, but reorients that into a more productive way of how can this person be educated? How can we do things to make sure this person learns how to better act with the world? And it's number 7, look for fortune telling, the future predictions. I just know my friends will not have fun at my party. Fortune telling is a big one, and as psychologists, it's one that we have to be very careful about. We learn different things in psychology, and we can sometimes be overconfident with our assessments because we spend so much time thinking in a certain theoretical perspective, and we can then often make the mistake of fortune telling, believing too drastically in our assessments and not leaving room for errors. So fortune telling is when you see something as a predictor of some other kind of behavior, and then you're convinced that that's going to happen. There's no way for us to know what's going to happen. They're pieces of information. This is very important to think about when you're doing maybe in forensic psychology. There are many books which are fascinating books on identifying pathological sociopaths, criminals, things to look for. One of those things that it seems that people who, a sign of emotional instability, and I'm going to raise the ire of someone in this lecture perhaps, but this is something we have to look at. In this example, one of the profiles that are looked at, one of the clues that are seen by forensic psychologists and profiles for, say, an emotionally unstable person, emotional instability, is excessive number of tattoos. It seems that there's a correlation between emotional instability and excessive number of body tattoos within our culture. Now, does this mean that every person who has an excessive number of tattoos is emotionally unstable or is going to be a criminal or do something that's damaging to others. Of course not. That would be an irrational belief. That would be fortune telling. That would even be all or nothing thinking. However, we have to rephrase the belief. We can't see a person who's has excessive the full bodies of tattoos, many tattoos, and then automatically think dangerous person. But we can, through evidence, through empirical evidence, say there is a tendency for people who are emotionally unstable to have a lot of tattoos. Now, again, does this mean that people with no tattoos are emotionally stable? Irrational thinking. It's a piece of information, one piece of a puzzle that may point to something and may not point to something. But to overlook it would be, especially if you're working in that field in forensic psychology, looking at psychopathology, it would be reckless to just dismiss that it means nothing, but it would equally be as reckless to make the assumption that it means something. It's something to be aware of, to just take into consideration. So that would be an example of how maybe a psychologist could fall into a certain fortune telling. This is something that we have to watch out for. Other researchers who are following in Ellis's footsteps have identified some basic emotions that we can use as clues to looking into irrational beliefs. When you feel or your client feels guilt, shame, jealousy, hurt, anxiety, depression, envy, and unhealthy anger. So anger in itself is not a bad thing, but excessive anger, unhealthy anger. These are clues that we have to look into the belief system, because these 8 emotional problems are self-destructive emotions. And if we continue in that belief system, those emotions will come to inform and guide the way we live our lives. So look for guilt, shame, jealousy, hurt, anxiety, depression, envy, and unhealthful anger as clues to looking into the belief system. The idea of rational emotive behavioral therapy is that you challenge the belief to find out if it holds up to, say, a scientific method. Does it hold up to the evidence? There are 5 categories of these irrational beliefs. Self-defeating is this sense that I'm a failure. And you see the people who live their lives with an I'm a failure belief system. The dogmatic belief system. Unrealistic ideal, a completely unrealistic preferences and wishes. A world that conforms to their idea of what the world should be. Antisocial. This is a way of being where the individual destroys social groups. Unrealistic. This is someone who lives their life misunderstanding reality. Contradictory. This is an individual whose beliefs are based on false premises. In other words, the logic is tight. The logic of their beliefs works out, but where they start from is the problem. Let me give you an example of this. If a patient comes in to your office and they have aluminum foil hat, and you ask them, why do you have an aluminum foil hat? And they said, well, this is keeping the beams from the satellite coming into my head to control my thoughts. Well, where does the beam from the satellite come from? Well, it comes from the government. The government's trying to control our thoughts, so they have a thought satellite that's 5G network is trying to etc. A lot of these conspiracy theories. And it comes down to the basic, the logic is tight. The person's story makes sense logically, that they'd wear a metal helmet to reflect a tin pot on their head, cook pot on their head, to divert so that they can think freely, and often this does help them to think freely. But the real problem here is the belief, and the belief system is one of persecution. That's something the government's out to get them, or something bigger than themselves out to get them. So you then look for the evidence of this. Now we're living in an age where you can find evidence for everything on the websites. So good luck with this one. Here are some illustrations of that we've discussed, that the REBT counselors are their directive. They teach skills. They teach the child or the adult how to challenge their beliefs. They teach them to look out for these irrational thoughts. They give homework assignments. This is our activating event, our belief system, our the A, B, C, D, E belief system of our REBT. Patients often think that their consequences are a result of the event, but it's the belief system that we need to really focus on here. Here's a nice example. Something unpleasant happens to us. It was awful and should never have happened. You become upset. The counselor, the therapist says, what is it? Why is it awful? Why shouldn't it happen? The person, it's a disappointment, not a disaster. I can handle it. So this is these reacting. Again, there's a lot of shifting from reaction to action. Just because we feel something doesn't mean we have to take it seriously. We feel something, and many of us just react to that feeling as if it's a click whir, as if we're obligated to that our feeling is accurate, and what our feeling is accurate to our belief. Now, if you can find that your belief is accurate, then you might have an authentic reaction. But the idea here is to switch from position of reacting to acting. Here are some more of these, some slides illustrating what we've already discussed about the cognitive distortions. Now, here is a very important aspect of REBT with children. Ellis felt that you can start to deal with children in a rational way after the age of 6. So after the age of 6, you might be able to give more, you might teach the child, you might be able to start teaching the child how to differentiate their feelings from as a reaction to their thinking rather than to the events. But before that, it's very difficult to do. So you have to do things with games and stories. Little children, 5, 6 years old, even up through 9 and 10, seem to react well to stories and tales, etc. And you have many moral tales, fables, Aesop's fables, and many different fairy tales you can use. Children's books are great for this. Any of the Shel Silverstein books, The Missing Piece Meets the Big O, The Giving Tree. The Dr. Seuss books are great for teaching the consequences of irrational thinking. So maybe children's stories, finding tales. There are many folk tales that are handed down that have morals, that have lessons, moral tales that teach the consequences of irrational thinking. And you can find, I spend time, usually in the cold months, I take a Sunday afternoon on the cold months, and I spend that Sunday afternoon in the bookstore in the child section. And I look through children's books, and I find good children's books. Incidentally, children's books are awfully effective with adults, too. They approach it as if it's just a charming little children's story, and they leave it having an insight. So the joy of playing games just because they're fun. Make things into games. Make things, little action figures or hand puppets or something like this. As you create a storyline, children react well and learn from storylines. They identify with characters in the story. Tell a story that illustrates the consequences of an irrational thought. Significant achievements rarely come easily, and nothing is wrong with working long and hard to achieve your goals. They are not bad people when they do not meet their goals. Perfection is not required to be a worthwhile person. These are all things we have to teach the children. Popularity and achievement are not necessarily related. Being worthwhile does not require 100% popularity. And guess what? Being popular doesn't mean you're a successful successful at living. A lot of people who are chasing that dragon, that drug of fame and attention, end up living very desperate lives filled with suicides and drug addictions and all kind of other stuff. We are living in an age where children are more and more obsessed with fame and with being envied and living up to something that they're seeing promoted as success. And a lot of adults buy into it too. And Ellis felt that it's part of our job to educate parents on setting a good belief system example. Don't take yourselves in situations too seriously. Don't turn minor setbacks into catastrophes. REBT has been known to be extremely successful in treating adults, treating children. The method of going about it with children is necessarily different than going about it with adults. When you're dealing with adolescents, 12 through the 20s, you can use the same techniques as adults. That means challenging the belief systems. When you're working with children, it's more about teaching them how to identify emotions and then identify the belief, the thought, this kind of ruminating idea that goes on in their head about identifying that as the cause of their emotion, not the event itself. So that is Rational Emotive Behavioral Therapy of Albert Ellis. Look at the additional things that I've included in on the Canvas module and enjoy this great insights for yourself and for the young people in your life.